Hi, on this slide, I will be speaking about types of depression. To begin, we have major depression. Individuals suffering or diagnosed with major depression may experience severe symptoms that interfere with their daily lives, such as sleep, concentrate, eating, hygiene, or their ability to work, just basically whatever is their routine daily activity. The major depression symptoms will interfere with that. And individuals suffering or diagnosed with major depression may experience a single episode or multiple. Moving on, we have persistent depressive disorder, also known as dysthymia. Individuals diagnosed or suffering from dysthymia will experience less symptoms. However, the mood of depression is persistent. It is known to last at least up to 2 years. Lastly, we have minor depression, and the symptoms are less severe and the time frame is not as long. Now, depression in our elderly population is frequently confused with the symptoms of their illness or the effects of their medication versus life changes. And in that population, like I mentioned, is a lack of care or maybe just a lack of knowledge. And so in result, our elderly population are being misdiagnosed. Hi, so on this slide, I will be speaking about causes of elderly depression. And as you see, there is many bullets here, and no, I will not be covering them all. I do have three categories: causes, medical conditions, and prescription. So in the elderly population, advancing in age is often accompanied by changes. Depending on the individual, they may accept these changes gracefully, and in another, population, they may not. And so because my topic is elderly with depression, I am thinking that my population at this moment is not transitioning pretty happy. So I have causes. It could be either health problems, loneliness, a loss of sense of purpose. Now, in causes, this category here, we have to keep in mind that they will be experienced loss. And at an elderly age, they will experience either a loss of a sibling, a family member, a spouse, also a loss of their home. They might have to now relocate, transition to a nursing skill, facility because they can no longer provide for themselves or take care of themselves. So that's something to keep in mind too. Now, between medical conditions and prescriptions, no, I'm not a medical provider, and no, I am not a pharmacist. But as a social worker, I am an educator. So I think between these two categories, what I can do for one of our patients that are suffering or diagnosed with elderly depression is definitely encourage them to be a bit more organized when it comes to their specialist and their medication. So as per why their specialist list, just to know where their records are at in case their record keeper, also known as a general practitioner, needs to do a referral or authorize for further appointments or get any medical devices for them. It's organized, and that can happen smoothly. In regards to prescription, it is recommended to tell our patients to please remain with the same pharmacy because if they are prescribed a medication, it might not actually mix with one that's current. And the great thing is if they remain with the same pharmacy, their data system has all the updated information and a life can be saved. So that's one thing that we can definitely do here. In this slide, I will be speaking about social worker and our listening skills. And so this is useful for when we are either completing an individual assessment or when we are facilitating a group session. Now, depending on the topic of our group session, it is very important for us to listen to cue words, which I went ahead and listed a couple on the bullets. So let's just say we're speaking about grief. Now, are the descriptive words that are being used by the individual sharing something that is common to say when they're speaking about grief, or is it depression? And so that's where the listening skills comes in. When an individual is constantly reminiscing about a certain time over and over, is kind of repetitive, they're pretty much stuck, is it dementia or is it depression? So those are the questions to ask as you're facilitating the group. Is just not, just making sure everyone has a time to share and teaching coping skills, but we are also listening to symptoms of depression. And so we have the Patient Health Questionnaire, also known as the PHQ, which is a multi-purpose instrument for screening, diagnosing, monitoring, and measuring the severity of the depression, and also their functioning level as well. Now, it is used in a clinical practice, and a clinician can actually do the scores. And so when we get our LCSW, we will be considered clinicians, so we can definitely do an assessment on the PHQ, and we can also sum it up as well. In this slide, I'll be speaking about psychotherapy and complementary therapies. So our population, which is the elderly population, either suffering or diagnosed with depression, I chose talk therapy with some CBT techniques. Now, the reason why I chose talk therapy is because the population that I am working with. So I am looking at the age from 75 and older, 75, 80 to 90s. Now let's think about the era they grew up in and what was their outlook on therapy and mental health. But what we have learned that in that era, mental health was not something that people spoke about. It was a family kept secret. Depending, exactly what year, a lot of individuals sent to institutions. So that also was frowned upon. So therapists and counselors were reserved for individuals like that. So now here we are, you're 75, 80, 90 years old, and you are showing symptoms of depression, and you are now being referred to a counselor or a therapist to speak about your problems. And so no matter how old you are, that learned behavior, that thought of, therapists and social workers are, or counselors are for individuals like that were institutionalized, people we frowned upon, that our community did for a long time. I don't want to be seen by them for what? So yeah, you're going to definitely probably begin your assessment with a little bit of resistance. Now, talk therapy is pretty cool because it's pretty like a conversational thing. You're conversing with this individual. You're asking leading questions. You're asking them about their life, and they might speak about some unaddressed issues. And those unaddressed issues, you continue to speak about that because it's therapeutic. And so you will learn that this individual never grieved for their husband of, 45 years, or their wife of 37 years. And this is the very first time. And so as they're speaking about them, it's therapeutic. It is a releasing. And so in group, when several individuals are doing this, it's awesome because they are sharing, they are it's a safe zone, they think it's just conversational, and at the same time is changing their mind that the counseling is not that bad, and they might come back. So now CBT techniques, it's pretty unique. It's a very unique thing because once again, it all depends on your client. So now if you're in a group setting, you can issue a CBT technique as a group homework. So let's say if your population, you're facilitating a group of the day that is elderly, suffering or diagnosed with depression with a little bit of anxiety. And several of the individuals speak about the challenge of getting out of bed, not wanting to get out of bed. And so a CBT technique would be like, okay, so let's set our alarm. And so the alarm is to get out of bed, and then let's set up another alarm of 10 minutes to get dressed. And so that alarm is a motivator. but it's also a technique because it's basically what CBT does, which eliminates the patterns and behaviors that contribute to depression. And so those little techniques, those little motivators, those little homeworks, it's CBT. And so that's why I chose those two. I decided to put in some complementary therapies there because I'm a huge believer on yoga and meditation. It's a support group setting as well. So it's a little bit more different because it's a physical exercise. Is mobility. So not only cognitive, you are speaking your feelings and you are in a group setting and you are listening to one another and you're sharing and you're thinking, but what happens to the rest of your body of releasing and relaxing? And so I believe meditation and yoga is a great contributor to also helping with depression. This is the last slide, and I'll be speaking about self-help tips. Find ways to engage. The population, elders suffering or diagnosed with depression, it is recommended, it is suggested that they find ways to engage. It helps decline depression. As I mentioned in the earlier slides, depression in the elders mimic one another. So depression could be an onset of illness itself, or the medication to treat that illness can be a cause of depression, or it can just be the change of life. There are changes of life. If that is the case of your client, then you, as a social worker, clinician, you will suggest some activities for them, depending on who they are, what they were accustomed to. Maybe they once had a hobby and they let go because of the depression, depending on their status of depression. If it's major depression, it does interfere with their daily life. So if they are improving because of the stability of medication, maybe it's time to reintroduce the things they used to do. And so second, we have adopt healthy habits. And so in our population, our elderly population, a lot changes. It could be like dentures, it could be taste buds, swallowing, they're not able to cook for themselves. So all that needs to be assessed when it comes to nutrition. And then ask questions in regards what they do as per being active, mobility wise. Are you walking? Do you use a walker? Are you able to walk? What do you need? Do you need a physical therapist to come on over to help you to do some daily activities and some daily exercises? And so adopting healthy habits is extremely important as well in declining the depressive mood. Foods really, really work with how you feel. Some foods are very heavy and sluggish and just rob you from your energy. And then if you can eliminate those and replace them with something that is much more healthier and lighter and can give you that boost of energy, hey, why not, right? So we can teach our clients definitely how to be much more healthier. And so last is know when to seek professional help. Absolutely. Know when to seek professional help. Know your body, know the difference, teach them what is the difference between, once again, grievance and depression. Grieving someone, it's a thing that you do. You grieve someone, but then depression is the length of it. Are you bathing? Are you no longer eating? Is it interfering with your daily activities? So know when to seek professional help. So it is important as educators, social workers, to definitely promote counseling. Change the outlook of our elderly population, what they thought once, what counseling or who needed counseling, to now the benefits of seeking counseling.